I don't really know what to say about this topic except to be super blunt. I spend more time than you would guess talking about penises. I didn't prepare for this in residency. I'm really surprised how many questions I get from parents. I'm actually kind of baffled by it because I got to be honest, I don't think anyone really cares that much about how a penis looks. Plus, they change a lot over the course of puberty into adulthood. Still, a lot of parents come into my clinic with kids of all ages and they want to make sure their kid's penis is okay. I will admit this though. There are a lot of different things that can be wrong with a penis and even more with the urinary tract. That's why there is not only a specialty of urology, but there is a specialty of pediatric urology. I'm going to talk through a few of the most common concerns that parents have about their son's penis that are normal. The abnormal things are usually picked up at birth. Things like having the urethral opening not located in the correct position at the end of the penis or absent testicles. Some babies can even have a rotational deformity of their penis. Pediatricians are really careful to examine a baby boy's penis because we know these things need to be fixed. The other thing we look for is something called micropenis because that can be a sign of a congenital disease or a serious hormone problem. I would guess that most parents who come into my office concerned that their child's penis is too small are worried about the cosmetic look, and they don't even realize that it can be a very significant sign of a bad underlying disease. I talked with pediatric urologist Steve Hodges. He's a urologist at Wake Forest University. We talked about this issue.
The biggest issue we see in penis size referrals is a big kid. You got to remember that the genitalia don't grow until puberty. But if you have a kid that's grown a lot, like we have these, let's say we have a big chubby 10-year-old that's prepubertal, all his private parts get lost in the shuffle, I say. And so they come in like they were fine size. It's just he got bigger. And so if you actually see a true micropenis, it's very impactful. It is markedly small. It's less than 2 centimeters on stretch length, and it just looks tiny. And I don't know how to describe it to someone other than I know it when I see it, and it's usually most penises obviously are normal size, and it's just the kid that got bigger. Also, sometimes they kind of tend to recess in the fat pad. A lot of kids have a prepubic fat pad where the penis will sit down in it. And so if you can push the fat out of the way, a lot of times you'll expose a normal-sized penis. You've seen a lot of ears or whatever, right, inside the ears. So you know, like immediately, is it infected or not? I've seen a lot of penises. I know just from a gestalt, okay, that's a normal size. And it's not just the length. The glans is really tiny in micropenis. It all looks really tiny. So I'm not saying it doesn't happen. It's just super rare. Most cases, if you just look at it and it looks about average, then they're fine.
The other question I get very often is about whether the doctor took off enough foreskin when the child was circumcised. Sometimes they could have taken off more. When the child goes through puberty, though, it's exposed to a bunch of hormones and the penis changes a lot and the foreskin tends to stretch out and not be so excessive. And in kids who weren't circumcised, parents ask if they need to retract the foreskin. Here's what Dr. Hodges suggests.
The other thing is the foreskin. If the child's not circumcised, the foreskin does not come back until puberty a lot of times. I always mention there was a study in, I think it was Netherlands, where they just followed kids with uncircumcised foreskin and didn't bother the foreskin at all. And they recorded when the skin was fully retractile. And the last kid was 17 years old. So at 17, the skin came back. And so I do see a lot of consults where the dad doesn't remember. He just knows that he has a retractile foreskin now, and he wonders why his 2-month-old or 2-year-old doesn't have retractile foreskin. And so you shouldn't force it back. And people over clean the penis, I think. They try to really get underneath there. And if the skin is fused, you can't separate it. So that's definitely the issues we see with foreskin.
One of the more common foreskin issues we do see in clinic that maybe needs some treatment is called balanitis. That's irritation or inflammation of the head of the penis. How do you handle that?
I think that most cases I see are kids with a lot of foreskin where when they void, again, I just finished saying don't retract the foreskin, but you don't want to let it hang loose. So when they void, you're kind of letting urine sit in the internal side of the foreskin. So they should retract the foreskin as far as it goes so it's tight up against the head. So when they void, there's less space to fill and retain urine, if that makes sense. Because I think urine sitting in there leads to inflammation and balanitis. And then when it happens, we can just treat it with steroid cream and sitz baths. And you can obviously do a circumcision if you want to.
Oh, so you don't need to use antibiotic ointment?
I don't. I just use steroid and sitz baths. You can, but I've not used it and done fine.
So when you potty train an uncircumcised boy, should you teach him to gently retract his foreskin when he's peeing?
Yeah, I have them hold it as they aim it to pull it back till it stops going easily. And that way it's kind of flush up against the head. And then there's nowhere else for the urine to go but out.
That's one potty training tip that I didn't talk about in episode 48, my episode about mastering the potty. Finally, I asked Dr. Hodges if there were any other issues that are referred to his clinic, maybe things that I don't see in primary care, but he sees because they're referred to him.
Oh, another thing, boys a lot of time will just start grabbing at it and they ask me, why is he doing that? And the penis is completely normal. I'm like, I don't know. The penis looks fine. I just know it's very common behavior. And they'll really yank at it. Like you'd think they're going to rip it off. And I just cover that thing up. I say, put the diaper on and keep them away from it.
Parents do bring their kids in for an evaluation because they're pulling on their penis very aggressively. If Dr. Hodges and I both see this, I don't think there's any pathology here. From a developmental perspective, we're talking about kids who don't get embarrassed. They don't know they're not supposed to pull on their privates, and they just found a really crazy piece of their body and don't have enough frontal lobe development or coordination to be gentle. Around 9 months, kids tend to pull like this on their ears, I also have a fair number of patients who take off their diaper and like to walk around holding their penis. Don't stress about this. If you've been listening to this show for a while, you may remember there was a parent who contacted me because her daughter was masturbating during nap time at preschool. This kind of behavior is really common, and it's nothing to worry about. If you want to hear my advice on that one, check out episode 4. I cover bedwetting and dealing with super chapped lips in that episode too. Speaking of bedwetting, one more plug for the brilliant Dr. Steve Hodges. His expertise as a urologist is on bedwetting and constipation, and you can find his very effective bedwetting program at bedwettingandaccidents.com. I'll put the link in the show notes. I want to leave you with one last thought from Dr. Hodges because this really resonated with me.
My favorite line is, I don't know what it's supposed to look like. It just doesn't look normal.
If you ever think something isn't quite normal and you want me to cover it, let me know. You can find me at drwendyhunter.com.